Well, believe it or not, spring is just around the corner, and that means dangers like rattlesnakes are beginning to stir and can pose a danger to our furry friends. Here to help out is Dr. Janice Trice from Windmill Animal Hospital. Thank you for joining us today.
My pleasure.
I know you're a busy woman, so we appreciate your time. Rattlesnakes, people are saying, oh, it's still cold, but now is really the time to start thinking about it. And what are some ways we can help our pets not get bitten, or for the after fact if they do?
Well, rattlesnakes are a fact of life out here in big country, and the one that we deal with the most is the western diamondback. They're not aggressive snakes, but there are a lot of them out there, and they'll defend themselves if a dog comes blundering up to them and tries to sniff them. So when dogs get hit, it most commonly is on their face and on their front feet. And there is a vaccine available to help create some antibodies in the dog's bloodstream. So the dog basically is carrying a bottle of antivenom in his bloodstream if he gets hit. If a dog gets hit, but he's been vaccinated, it doesn't mean that he doesn't need veterinary care, but usually he'll stay alive long enough to where the owner can get the dog to a veterinary care center and we can start treatment.
And let's talk about what kind of dogs should be getting these vaccines. Obviously, I live in the city, but may still be a good idea just to get that vaccine.
Well, this is where you need to poll your neighbors if you live in the city and kind of get a feel for how many rattlesnakes have been seen in the neighborhood. Some parts of town see rattlesnakes regularly. Other parts of town haven't seen them in years. Dogs that live on farms and on ranches, dogs that go hunting and fishing, dogs that go camping with their owners, dogs that go to the lake because there'll be snakes and there's rocks around the lake. Those are all high-risk dogs. Like my husband and I have hunting dogs, and our dogs are all faithfully vaccinated. In fact, I'm going to be vaccinating everybody this weekend. So I'm walking the walk.
And let's talk about how to prevent rattlesnakes. Obviously, it's not a surefire way to prevent them, but there are some steps you can do to make sure.
Well, so many times when we have a dog brought in that's been hit by a rattlesnake, then with questioning the owner, we find out that we've got some brush or piles of trash in the yard, or we've got a wood pile that's sitting on the ground in the yard, or they keep a bowl of food out for the local cats. Well, not just cats come in to eat the cat food, the rodents come in to eat the cat foods, and where there are rodents, there will be rattlesnakes. And so if you remove places for rodents to hide and remove food sources for rodents, then there's nothing for the rattlesnakes to come in for. So it really reduces your risk.
And you know, getting care for a rattlesnake bite, or really any kind of emergency care, can be costly, but you said there's ways that we can maybe prevent from having a big bill like that.
Well, rattlesnake strikes, it all depends on dose. How much venom did the dog or cat get injected from the snake? Adult rattlesnakes are able to monitor or to regulate how much venom they inject. But even a dry strike can be tough, but baby rattlesnakes are going to give a full dose every time. They can't regulate yet. So rattlesnake strike management is intense and it's expensive. And it may or may not be successful. So I recommend to all of our clients whose dogs and cats are living in high-risk areas, go ahead and get pet health insurance. Get Major Medical pet health insurance to cover the catastrophes. Like the dog ate a sock and needs emergency abdominal surgery, or a hit by car, or a rattlesnake strike. And maybe you won't have $1,000 or $2,000 or $3,000 bill. Or even more. It can get amazingly costly.
Best way to do that, really just go on Google and search for different ones.
Yeah, just do your research on the different pet health insurance companies and look at your reviews, and then look at all the different plans that are offered and see which plan is the best fit for you and your pet.
All right, well, we appreciate you coming on, and I'm sure all of your pet owners just love the advice you give them as well. So if you have any questions or concerns about your pet, you can always visit Dr. Price at Windmill Animal Hospital, or give them a call at 698-VETS, or go to windmillvet.com.